Good afternoon, everyone. It's my pleasure to welcome you to today's MHF Top 10 webinar, Top 10 Lessons Learned About Approaches to Facilitating Citizen Panels on Priority Health System Topics. Our webinar series features top 10 insights into health systems, evidence-informed policymaking, and a range of key health issues from forum experts and influential policymakers, stakeholders, and researchers from around the world. Our mission is to be the group internationally supporting leaders and citizens who want to use the best available research evidence to strengthen health and social systems and to get the right programs, services, and products to the people who need them. As such, we're excited to have François-Pierre Gauvin here with us today. I'd like to welcome François-Pierre Gauvin. François-Pierre is the McMaster Health Forum's scientific lead of evidence synthesis and Francophone Outreach. His role includes assisting in the process of gathering evidence for many of the Health Forum's programs, including citizen panels and stakeholder dialogues. He also acts as the knowledge broker for the Cochrane Policy Liaison Office. François-Pierre is a former member of the Center of Excellence on Patient and Public Partnership at the Université de Montréal and the National Collaborating Center for Healthy Public Policy at the Institut National de Santé Publique du Québec. His research interests focus on evidence-informed policymaking as well as public engagement in addressing socially and ethically complex public policy issues. We'll start today's discussion by providing a brief overview of citizen panels, why they matter, and their key features. FP will then share his top 10 lessons from a citizen panel program for engaging citizens in setting direction for broad system changes.
Hi, everyone. It's a pleasure to be here. I hope everybody can hear me correctly. I just want to first acknowledge one of my colleagues, Michael Wilson, who's currently on parental leave. Michael is the Assistant Director at the McMaster Health Forum. He's been leading the Citizen Panels program for the past couple of years, so I want to acknowledge his contribution to the presentation. And also I want to acknowledge, I believe we have in the attendees, Caroline Canfield, who's one of our members of the advisory group for the Citizen Panel program. So welcome, Caroline, welcome everyone. So today I'll be sharing some lessons from our Citizen Panel program that we set up back in 2013, so about 4 years ago. We set up those panels to provide insights from citizens about setting broad system changes. And as you'll see, we addressed multiple topics over the years. We actually hosted 39 panels. We have one more coming up this Friday on a variety of topics ranging from palliative care, end-of-life care, home and community care, on how to support caregivers, how can we improve risk assessment and management with surgery patients, and so on. So a lot of great diversity in terms of topics. We hosted these 39 panels with more than 500 citizens so far. So quite a lot of experience, but still it's a work in progress. So we're still learning as we conduct panels, and we hopefully can engage in a conversation with you to learn from your own practices and other best practices in this area. So first, a simple question: why engage citizens in evidence-informed policy making? We've been developing a lot of very sophisticated knowledge translation strategies. We're getting better at producing pre-appraised, synthesized documents, providing a great comprehensive overview of research evidence and stuff like that. But what can citizens bring into evidence-informed policymaking? I think it can bring a lot of things. First, citizens can help us to understand and provide a shared understanding about a complex problem. And we're dealing with a lot of complex problems in the health system. And although we have access to a vast amount of literature on many topics, citizens can really provide different insights on these problems. They have experiential knowledge as citizens, as patients, and as caregivers. They also have ideas that they can contribute to finding solutions. And also they have values that can help to guide policymakers in finding innovative and local solutions to complex problems. Another thing that citizens can do is to facilitate or trigger action. They're extremely good at providing guidance on how to move forward. If we want to implement a policy option, what do we need to consider? They're also very good at identifying what options are socially, politically, and ethically sound. So again, a great contribution that they can make. And lastly, they can also advocate for policy options. We can help them, inform them, and provide them with the tools and skills to go and advocate for policy options beyond the citizen panels. So these are some of the reasons why we decided to set up this citizen panel program back in 2013. So I'll briefly provide you some description of the key features of the citizen panel programs. And as Stephen mentioned, we'll talk about some of the key lessons or insights that we have learned so far about setting the program, but also about citizens' views and values regarding broad system changes. And then I'll open up the conversation for some question and answers and also ideas and suggestions that you may have to engage citizens in evidence-informed policy making. So in terms of key features, whenever we set up a citizen panel program, we usually receive a request from a government agency or a non-governmental organizations, and sometimes they are initiated by the forum ourselves. So we may set up a project, finding some partners and sponsors, but usually they come from an organization asking for input from citizens. The first step in the process is we're going to set up a series of consultations with key stakeholders about the specific issue to consider. We'll then prepare a citizen brief. We'll convene a citizen panel. We'll prepare summaries of the key insights from citizens, and then we'll implement a knowledge translation strategy to try to support action regarding the issue. So let me briefly describe each stage a bit more in detail. So the first step is really to consult with key stakeholders right from the start. These could be public and patient representatives, researchers, stakeholders, policymakers that we consult early on. And we do that in different ways. The first way is to set up a steering committee for each project, and the steering committee provides guidance on the recruitment strategy for identifying citizen participants. So we develop a series of inclusion and exclusion criteria for the panel. We also consult the steering committee to have a better understanding of what's actually the problem that we're facing, what are potential policy options that we could submit to the participants, and also start thinking about implementation considerations. And the steering committee also helps us to identify key informants that we should have a conversation with to, again, have a better understanding of the situation, of the problem, and of possible policy options. And usually for each project, we conduct approximately between 15 to 20 key informant interviews with citizen, patient representatives, policymakers, stakeholders, researchers. So this is the first step. And as we do the consultation, we start gathering research evidence into a citizen brief. So we prepare a document which is hopefully within 15 to 20 pages where we present in plain language some of the research evidence about the problem, about the potential policy options to address the problem, and also about key implementation considerations. So these citizen briefs are informed by the preliminary consultation, but also by synthesis and local evidence. So usually it's done through a search for systematic review and original research studies on a specific issue. In these briefs, we do not provide recommendations. So we're trying to be, if I can use the expression, honest brokers. So we're providing information to support the citizen deliberation, but we're not framing the brief in a way that could lead the citizen deliberation in one direction or in another. All the briefs that we produce are subject to merit reviews by researchers, policymakers, stakeholders, but also by patient and public representatives. So that's really important to us, that to have at least a patient or public representative reviewing the document to ensure that it's appropriate in terms of content, that it's relevant for citizen deliberation. One thing that we added in the last couple of panels that we did is we include in our citizen brief a series of questions. So we usually have an overarching question and very specific questions that are introduced at the beginning and at the end of the document to support the participant as he or she reads the document, to always keep in mind what are the key questions that we're asking, what are the key questions that will be discussed and deliberated at the panel. The next step is to convene the citizen panel. So those panels are usually convened between 14 to 16 citizens for 1 day off-the-record deliberations. So we're hoping that the participants will bring their own views and experience on an issue. They will learn from the evidence that we provided in the brief and also during the day, and also learn from the views of other participants and the experiences of other participants. And hopefully, they'll provide an informed judgment on the issue. So we'll move from providing raw opinions, raw experiences, to newly informed views about the issue and how can we address the issue. One key aspect, and I'll discuss that a little bit later, is the recruitment of participants. We have different recruitment modalities. Most of the participants are recruited through Asking Canadians, which is an online pan-Canadian panels of Canadians from across the country, and they are randomly selected through that large pan-Canadian panels based on specific criteria. The panels, they do not aim for consensus, so that's another characteristic of these panels. But we enjoy, if there's any consensus emerging naturally, we'll be welcoming the consensus, but we're not forcing a consensus during the citizen panel. All panels are facilitated by a skilled facilitator or moderator, and there's going to be a thematic analysis that will be prepared that emphasize the shared understandings and the divergent opinions that came up from the panel discussions. And now, something that's new, and I'll talk about that a little bit later, is that many of the citizen panels that we organize are now preceding a stakeholder dialogue focused on sparking action on the same issue. So the McMaster Health Forum has been known for several years for their stakeholder dialogues. So we would be bringing fairly high-level policymakers and health system stakeholders and researchers and sometimes patient representatives. But since we created the Citizen Panel program, we explore different ways of how can we better sequence the citizen panels and the stakeholder dialogues. So we tried different approaches, and now we've set on the decision that we made is to always host the citizen panels prior to the stakeholder dialogue so that we make sure that all the input from the citizens actually feed into the stakeholder dialogue. The fourth key step is preparing a panel summary. So it seems simple, but it's sometimes quite complex. So we conduct a thematic analysis of the deliberations. Sometimes the citizen participants are able to make very clear value statements that are very clear, very explicit, and it's easily to summarize, but sometimes we need to dig a little bit deeper and analyze the content of the deliberation to produce the panel summary. So the panel summary will describe the views about the issue, the experiences of citizens regarding the issue. We'll also describe their values underlying their positions. And whenever possible, we clearly identify what are the areas of shared understandings and commonalities, and where are the divergent opinions. So we want to make sure that we are nuanced in our panel summaries, and we provide all the different perspectives that came up, that emerged from the discussion. The fifth and last stage is try to support action. So we set up a multifaceted knowledge translation strategy. So we have personalized briefing with key health system leaders and stakeholders so that we can provide them with what are the key insights about the citizen panels. And as I mentioned before, we convene the stakeholder dialogues with policymakers and stakeholders after the citizen panels now, so that all the information that emerge from the citizen panels is now integrated in the evidence brief that we produce and in the deliberation of the stakeholder dialogue. So now let's move on some of the key lessons that we have learned over the past 4 years. And again, the panel program is still relatively young, 4 years, and it's still a work in progress. So we're still learning a lot. But one of the key lessons that we've learned so far is basically establishing an evaluative component to the citizen panel program. So right from the start, as we created the citizen panel program, we decided to build in an evaluative component that will help to conduct a formative evaluation of the panels, also a summative evaluation of the citizen panel program itself, and also an evaluation of how the nature of the issues that are being deliberated and the contextual factors around the citizen panels program can influence the impact of the citizen panels and also influence citizens and policymakers and stakeholders' views about the panels. So this evaluative component is really key in our program, and unfortunately, evaluation is often overlooked when we do citizen engagement activities. So right from the start, we said we need to put that in place, and that's been quite an important component to learn and improve the citizen panel program over the past 4 years. So I see there's a question. Let me see if there's one of the questions from the University of Manitoba. So who is the facilitator of the panel, and how is the person chosen? So essentially, the facilitators are usually from the McMaster Health Forum. So they have been trained to become facilitators. They're also usually quite involved in the production of the citizen briefs, so that the facilitator has quite a deep knowledge of the area and a keen understanding of the different challenges, the different policy options that are on the table. So all the facilitators so far have been from the McMaster Health Forum. Back to the evaluation component. So it's a multi-faceted evaluation infrastructure that we put in place. We have evaluation questionnaires that evaluate the key features of the citizen briefs that we produce. There's also a questionnaire for the actual citizen panel itself. We also have non-participant observation and audio and video recording of the deliberations. And the last part of the evaluation, we also have a self-administered questionnaire to assess the panel summary and also provide feedback to the forum team about their experiences. And just recently, we added another component. We added semi-structured interviews with purposefully sampled number of participants, usually between 3 and 4 panel participants, to have a conversation about their experiences. So we want to learn from the beginning of the process, when they were first approached by the forum, until the very end of the process, when we finalized the discussion and provided them with a summary. And these semi-structured interviews have been really useful to dig a bit deeper to understand the experience of participants. The second big lesson that we've learned, and again, we're learning about this issue, is how can we develop a robust and flexible recruitment strategy? And if you're involved in public and patient engagement, some question that you often get from policymakers is, who are the citizens? Who are the patients? How do you select them? It's not an easy question. It seems simple, but it's not necessarily simple. We know from the literature that there are many recruitment strategies. We can do open calls on social media and ask anybody interested to join the panel to submit their candidacy and so on. Another method that has been used in the past by one of our researchers, Julia Abelson, is the civic lotteries. So you send an invitation to a randomly selected sample of households in a region or in a province, and inviting them to submit their candidacy. So all these recruitment strategies have their benefits or have their limitations. One of them is that it can be extremely costly in time and resource intensive. In the case of the citizen panel program that we set up, we aim for a recruitment strategy that offered the capacity to recruit a broad representativeness. We wanted to aim for broad representativeness of all those that can be affected by a problem, but also those who could be affected by the potential policy options that we put in place. We also wanted to put very targeted efforts to recruit vulnerable people and those who are hard to reach. So how can we put in place a strategy that helps us to do that? And lastly, we wanted a recruitment strategy that allowed us to deploy the citizen panels very rapidly to take advantage of a window of opportunity. So you know that in the life of a policymaker, we often live in a fast-paced policy environment, and sometimes there's a window of opportunity popping up. The health minister may be interested in addressing some issues, but they rapidly need some input from patients, from citizens. So how can we put in place a recruitment strategy that can help us to rapidly set up these citizen panels? So we right now we put in place a strategy that uses mostly a random sampling strategy. So it's an online recruitment via Asking Canadians, as I mentioned. So it's a pan-Canadian panel. But sometimes for certain topics, we use other modalities. It could be a recruitment via disease-specific organizations or community organizations. Sometimes it's a mix of these strategies. We had to do that for certain panels that we did, for instance, in Northern Ontario. We wanted to recruit people living in very rural and remote areas, people from minority groups, from Francophone minorities. We wanted to organize panels with members of First Nations, Aboriginals, Métis. So in these instances, we need to find different strategies to recruit. But so far, the approach that we took was a random sampling strategy. For each panel, we usually select the participants based on very explicit criteria that we put up front. So it could be in terms of age, gender, place of residence, could be their experience that they have as an informal or friendly caregiver, could be because they have a chronic condition, their socioeconomic status, and ethnocultural background. So these, we usually define a profile right up front of the type of citizen panels that we would like to have before we launch the recruitment strategy. So that's, maybe I could provide you some examples. So here's the profile of participants to the first 35 panels that we did. So we, as I mentioned, we have 39 panels, but we were able to aggregate the data for the first 35. So we had 444 participants. We usually are pretty good at having a balance in terms of male and female. In terms of age, you'll see in terms of age and status, it's a bit skewed towards older adults. The reason is that we've hosted a lot of citizen panels on aging-related issues, caregiving, and so on. So that's maybe why it's a bit skewed in that way. In terms of outcome, it remains fairly balanced. Having done a lot of citizen engagement initiatives, I've been surprised to our capacity to reach out to people who are actually very vulnerable in terms of their socioeconomic status, people who have experienced poverty, homelessness. So we were able to reach out to some of those individuals. But again, I think we still need to improve our efforts in this area and keep continuing to be proactive to recruit more vulnerable and hard to reach citizens. So in terms of ethnicity, it's kind of interesting. We asked that question about ethnicity. It hasn't been so useful so far because most of the vast majority of participants basically define themselves as Canadian. So that question hasn't been as useful as we would have hoped, but it kind of gives us a sense of how people define themselves when they come to the panel. So, a third lesson now. Let me see. I see there are a few questions coming up. I'll just see. How do we ensure that the citizens chosen are impartial and do not impose personal, religious, and political biases into the topic of discussion, which is important in the comments are translated into action through stakeholders and policies. So we are trying to be upfront. In some circumstances, we have exclusion criteria in our recruitment, and they are made very clear. For instance, if someone is a healthcare professional, if someone is working in certain areas or domains, sometimes they may be excluded for the citizen panel. So we'll put that up front. In terms of imposing personal, religious, political biases, I think we can't control for everything. So there are some individuals who will express. I can remember some of the panels we did on palliative care, end-of-life care. So certainly, personal, religious considerations come into play, and I think it's quite clear if we play it out very transparently and out in the open that we have a clear conversation about that. Usually, the dynamic that I've seen in the conversations that we had with the panel participants, they're fairly good at moderating themselves as a group. They don't try to self-impose their views. I haven't seen that in the 20 or so citizen panel that I facilitated. It may happen that some people are a bit more talkative, a bit more assertive, but never in a way that they would impose their views or they would really skew the conversation in an important way. I think the group dynamic is pretty good at trying to manage that. Let me see, I think there was a few other questions. Can you please go into the recruitment strategies for hard-to-reach populations? Yeah, that's a good question. So for asking Canadians, they are pretty good at having a panel, having some background information about all the members that they have on their pan-Canadian panel. So in terms of socioeconomic status and some other characteristics like ethnocultural or linguistic minorities, they can send very targeted invitations to individuals from these groups. So they can send potentially more invitation to more marginalized or potentially vulnerable individuals. That helps us to potentially recruit more among these vulnerable and hard-to-reach groups. But what I've seen also is that we do need also to work with people who are actually non-governmental organizations, service providers that are on the ground within the communities, and sometimes they can help us to share the invitation and sometimes send targeted invitations to certain individuals. It's not easy to do, and we hope we can improve the strategies that we have to reach these individuals. So if you have any suggestions, that would be really, really useful. In terms of outcome, it's usually individual outcome, the data that I showed. And another question, do you think there are ways we can try to specifically increase youth involvement? That's a good question. One thing that I think it's, in our case, as I mentioned, it's a bit skewed in terms of age because of the topics. One way I think we can improve youth involvement is the way we frame the topics and also the topics themselves. We had a couple of topics that were more interesting in terms of youth. For instance, the use of health information technologies. There was some discussion about mental health issues among younger adults and so on. So I think the way we frame the topics and the topics themselves may potentially be one of the best approach to try to increase the recruitment from younger individuals. Let me go back to the presentation and I'll come back to some of the questions later. So if I move to the third key insight from the Citizen Panel program so far, is that as we started those citizen panels, and I remember the first two ones we did were on palliative care and end-of-life care. There was a lot of information coming up from these panels, a lot of information. And we quickly realized that we need some tool to help us analyze all that information, and also a tool that could help us understand what are the underlying values that may explain the positions of all the participants. So that's why we decided early on to create a values framework. And if you look in the literature, values frameworks are becoming very popular. In our case, we decided to develop our own values framework to inform the work that we do and inform also the analysis of the citizen panels. And values, it's something a bit complicated. One of my professors, Mita Giacomini, and some of our colleagues a few years ago wrote a paper on values, and they said that values basically are like atoms. They're everywhere. They're like atoms. They're all pervasive, extremely important, yet they are often invisible, and that's true. When we talk with citizens, sometimes they don't talk in terms of values. They don't talk in terms of equity, compassion, in terms of fairness, in terms of empowerment. They will express their feelings, their views, their ideas, but not necessarily very explicitly in terms of values. Another thing that makes it complicated is that, like onions, values have multiple layers. And if you want to analyze the values, you need to go through all the layers of reasoning. So that's why we decided fairly early on to develop and incorporate the use of a values framework to guide the analysis of our citizen panels. And in a few moments, I'll share some of the information that we have right now. We're still working on that values framework, by the way, and trying to make sense and cluster and organize the different values that are emerging from our citizen panel. One of the big challenges that we encountered is how do you package evidence to support citizen deliberation? That's a question that was quite important to us since we've been, the McMaster Health Forum is quite heavily involved in knowledge translation, in producing knowledge syntheses to inform policymakers. And you know, there's an increasing body of evidence actually to inform how we translate or transfer knowledge to policymakers, how we produce evidence briefs for policy. But we don't really have that for citizens. We know that citizen panels and other deliberative dialogues usually are informed by a pre-circulated brief, a document of some sort that will mobilize some relevant evidence to spur discussion among participants. Usually we do that because we want participants to move from their raw opinions about an issue to a more public judgment. And that's an expression, public judgment was an expression used by Daniel Yankelovich, who just recently passed away. Also, what we've seen from the work of Julia Abelson and her colleague is that whenever we provide them with information before the deliberation, it usually increases satisfaction of participants. But how do we do that? How do we create a document that will be useful to participants, that they will get the information they need, that they will understand the information that they find, and that they can actually use in the deliberation? So that's a big challenge. So, and that's where we decided to produce those citizen briefs and improve them over the past couple of years. There's been several refinements since the launch of the Citizen Panel program. For instance, we took a simplified approach to presenting the evidence. So I remember at the very first few citizen panels we did, we had citizen briefs with very detailed tables and appendix, so that if there were any citizen interested, they could go in the appendix and get more details about the systematic reviews. And we then realized that this information was not useful at all, and it kind of was even overwhelming to some of the participants. So we decided to remove that altogether. We also decided to provide not just information through a citizen briefs on paper, but also through verbal description during the panel. So during the conversation, sometimes we provide information verbally with some visuals, infographics, so that citizens have another way of getting familiar with research evidence. We did also additional simplification, making a better use of figures and infographics. And as I mentioned earlier, we included more general and specific questions within the brief so that when people are reading that document, they have a clear idea of what's the overall question that we're asking to the participants. What are the very specific questions that I also should think about and maybe talk with my family and friends before I get to that citizen panel. But again, packaging evidence is quite challenging, and my colleague Mike Wilson and a few others are actually working on a scoping review to try to document what's out there in terms of how do we package evidence to inform a citizen and public deliberation. The scoping review hasn't been published yet, it's been submitted, but there's something that will come up shortly and that could be useful to us. So that was more, I would say, a bit more about the content, but about the format, but the content is also quite important. And one thing that just recently, that I knew, but recently a public and patient representative spoke to me and made a very strong argument that language matters. One thing that we need to realize is, of course, language matters, but it matters beyond literacy considerations. We know that a lot of Canadians are struggling to read basic health information. So for sure, we need to provide documents that are clear and simple so that they can make an informed decisions and use information. But also we need to be mindful of the underlying values of the language that we use and how we define and describe problems and describe options and the simple word that we use that can make a whole world of difference. And just recently I was writing a citizen brief about how to support and improve how healthcare professionals assess and manage risk in surgery patients. And the merit reviewer simply said, well, it's not in surgery patients, it should be with surgery patients. And I said, well, it's simple and brilliant. But unfortunately, we get in those old habits of writing in this way, and we forget that we need to adapt the language so that it's more engaging to citizens. We also need to align the language that we use to existing efforts in the public and patient engagement area, and also with existing policies. And that merit reviewer said you should look at existing policies that are pushing forward greater public and patient engagement and try to use the language in there when writing the citizen briefs. Let me go, I see a few questions. I'll try to answer some of them. Caroline, what do you do about constraints that might limit participation from time or day of week, travel to the meeting, mobility, hearing site limitation, work, and also the obligation that might impact participation? That's a very good point. So how did the Northern Ontario panel deal with participations from every remote site? Face-to-face in-person deliberations seems a core strength. Yes, that's an excellent question. So there are many impediments to participation. There are many obstacles to the participations of citizens, not just those that are vulnerable and hard to reach, but also people who may have family obligations, work obligations. So we've been testing different approaches. A lot of the panels that we did were hosted over the weekend. In some instance, because we wanted to have people who were dealing and balancing work and family responsibilities, and we thought that doing those over the weekend could help us do that. We also implemented a policy to reimburse caregiving expenses. So not only are we providing a per diem, providing all the travel and hotel arrangements to support as many people, as many participants as possible, but we're also providing, in some instances, financial support for those who have caregiving expenses. So for instance, if you're providing care for a loved one and you need to pay a nurse to spend a day while you're deliberating with the McMaster Health Forum, then we can provide reimbursement for these types of expenses. For the Northern Ontario panel, it was, of course, challenging. People were coming from extremely far away. We hosted the panels in Sudbury, and what we did, we tried to host the panels in two ways. So we had a face-to-face panel, and a few of the participants that were coming from very, very far were joining us through webcams. It's interesting, but it does provide challenge. It changed the dynamics of the deliberations. So I'm not an expert in how do you deal with both face-to-face and web-based deliberations, but this is, I think, an area that we need to look at. How can we manage that? And because it's a reality in Canada. People are coming from very far away, from multiple regions. How can we set up a panel process and an infrastructure that help us to host these kind of deliberations from people from all over the place? Diane, I may have jumped having there. Do you have any specific examples of information related to how the input and discussion that comes from the citizen panel is more concretely incorporated into policies and outcomes that we can see? So that's something I'll try to come up a bit later when I talk about the impact. So I'll come back to that later. Diane, have you considered storytelling as a means of packaging evidence? We did for a few panels. So I believe they are now up on our website. We hosted a series of citizen panels on cancer drugs. And for these panels, those panels were sponsored by the Canadian Partnerships Against Cancer. And we built on a previous project that was done in BC with Stuart Peacock, Michael Burgess out in BC. So we built on this BC experience and conducted a series of pan-Canadian panels on cancer drugs. And for these specific panels, we used storytelling as a means of packaging evidence. So we had two ways. We had a video being done to present stories from clinicians, from patients, from policymakers, and also during the day of the panels, we also had people who would be providing witness testimonies, share their own stories, share their own experiences with dealing with cancer and having to make difficult decisions regarding cancer drugs. So yes, storytelling I think can be a very powerful way to package and present evidence. Thank you, Diane. I'm just going to go back quickly to the presentation and circle back to the questions in a moment. So let me go back to the presentation. So let's go to maybe the sixth lesson that we've learned, building for impact. So I think that's quite an important thing to do. We want to make sure that what we do has an actual impact, and the citizens who took part in our citizen panels, usually they always end up the day and sometimes beginning the panel with questions about potential impact. They want to know how it's going to be used. They're going to spend the day and sometimes a couple of days prior to that reading material, getting informed. They come to a citizen panels, they take a day off sometime, they travel to the event, and they want to make sure that what we do has an actual impact. So we put in place multiple strategies to ensure that the citizen panels are both relevant and that they have impact. The first one that we do is we always do a citizen panels if we have a clear sponsor who can take action on this issue. And we only do citizen panels on pressing health system challenges that are currently on the government agenda. So there must be people in and outside of government who knows that this is a serious issue and we need to take action. Another thing that we do is we engage both citizens and health system leaders early on in the project. We do that in multiple ways. We do that through our advisory group. We have an advisory group that provides overall guidance to the citizen panels. We set up very specific steering committees for each citizen panel that we host. We also conduct key informant interviews and a merit review process that helps to ensure relevance for the briefs that we produce. All the policy options that we usually put in our evidence briefs are options that are on the governmental agenda or that health system stakeholders are considering and citizens are also considering. And lastly, how we sequence the citizen panels in a way that they can precede the stakeholder dialogue has demonstrated some impact on some of the topics so far. And a lot of participants rated this feature very highly. In terms of actual impact, we do have in some of our reports some impact stories of the Citizen Panel program. Could be with the Ontario Medical Association when they were doing some work on palliative and end-of-life care, and a few other organizations. So maybe at the very end, I could try to send you a link to some of these impact stories for the Citizen Panels. Now let's get into some of the preliminary findings from the evaluation that we're doing, and what are the citizen views regarding the citizen briefs, the panels, and the health system. So it's interesting to, as you'll see, so far overall, so we do have questions for very specific features of the briefs and panels, but overall, both the brief and the panels are rated fairly highly on a scale of 0 to 7, 0 being disastrous and 7 being extremely useful and meeting their objectives. So both the briefs and panels have been rated very highly across the citizen panels that we have hosted so far. In terms of, and one question that we're asking in the evaluation process is right away, what are the how do citizens rate the quality of their healthcare system? And usually what we see is that citizens rate it usually between a 4 and a 4.5 in terms of quality of the health system. So they define this as a system that's relatively good, but that requires tweaking and improvements. So they are still unsatisfied about some elements of the healthcare system in terms of access, in terms of quality, in terms of safety. So, so here's the rating for the quality of the health system. And one thing that we also looked at, we asked questions before the panels and after the panels, asking about the knowledge of the participants regarding the issue being discussed. And what we see is usually we see an increase between the pre-panel and post-panel evaluation of their knowledge of the issue. So showing that they have the impression that by reading the brief, that by having a full day conversation with other citizens, that their knowledge has increased regarding the health system issue that is under discussion. One thing that is interesting is that if we look at the lowest ratings of the quality of the health system, I have some notes here. Usually, the lowest ratings of the health system usually come from some of the indigenous participants, those from African descent, those with technical school training, those that are unemployed, or students. So these were the groups that usually rated the quality of the health system lower than the rest of the panel participants. Maybe the 8 lesson so far, and I'll try to wrap this up so we can answer some of the questions. But one thing that I've been quite amazed is the capacity of citizens to be engaged on a wide range of complex issues. And you'll see all the health system challenge and issues that we have dealt with so far. We also had 39 panels on various issues ranging from governance arrangements, financial arrangements, delivery arrangements, for multiple conditions, multimorbidity, cancer, different chronic conditions, for different populations, for older adults, for caregivers, those requiring assistive technologies, and in many sectors, primary care, home and community care, specialized care, surgical care. The panel that we're hosting on Friday this week is on surgical care. A few years ago, we did a couple panels on complex cancer surgeries. So I don't think, and sometimes some people who are reluctant to engage citizens may think that there are a lot of topics and challenges within the system that citizens can't really have any insights on. And I would say it's not true. From the experience that we had with the 39 panels, 500 citizens coming together to deliberate on various issues, I think they are able to have a very sophisticated conversations on very, very complex issues that we're dealing with in the health system. Again, going back to some of the key values that emerge so far. So here's some preliminary results from the evaluations and from the analysis of the citizen panels that we did. So you'll see the percentages, the number, the frequency of panels, percentage of panels where this value emerge as a key and dominant value in the conversation. So we kind of cluster the values in different categories. So there are values related to outcomes. And what you see is that in 58% of the panels that we hosted, one of the key values that emerged was that people were looking for excellent patient experience. So they want care that is patient, family, and community-centered. So that's really a key value that emerged from our conversation so far. Another value in that case related to criteria about whether to proceed. So when we need to make a decision and we have trade-offs to make, fairness and equity consistently could pop up. In 58% of the panels we did, fairness and equity came up very strongly. In terms of the type of input needed to make decisions, interesting that in 47% of the panels that we did, I think the participants were really focusing on the need that health system decisions must be based on data and evidence. In contrast, in 26% of the panels that we did, they also focus on the need to integrate citizens' values and preferences in decisions that must be made. And interestingly, a couple of other values that came up that emerged from the panels about how to move forward, how to proceed to bring broad health system changes. This issue of collaboration emerged very strongly, and it's interesting because participants focus both on collaboration within the health system, so trying to break the silos within the system, but also in many panels, participants were really good at advocating for collaboration between sectors and to put in place whole of government approach. If we want to deal with some of the pressing challenges that we have today, we need to bring not just the health system together, but also all the different social systems in place. And other key values that emerge, but we are still grappling on how to group them. One of them is empowerment. I think it's in 68% of the panels, empowerment emerge as a key value shared by citizens. And lastly, before I conclude, maybe the last lesson is that deliberation or public deliberation, it's an acquired taste. Many of the citizens that we invited to the panels, you could see that at the beginning they come to the panel, there's a lot of uncertainties. They haven't been engaged like that before. We're not familiar to them, so who are you, the McMaster Health Forum? We've never dealt with a university, or what are those non-governmental or governmental agencies involved in the project? So a lot of uncertainties. But as the day went on, as the conversation unfolded, they really got a taste for deliberation, an appetite for deliberation. And there's a quote from one of the participants saying that how exciting it was to be part of that panel as a Canadian to take action regarding the broad health system changes. And same thing coming from policymakers. In that case, the policymaker was referring to consumers or citizens, and those who care for them are an extremely important part of this exercise. We must find ways to expand our efforts to hear their voice. So with that, I would conclude, and just maybe as 3 take-home messages that citizen panels can provide a mechanism for evidence-informed deliberation, and they can really provide key insights to inform pressing health system challenges. There are other mechanisms as well, but in our case, the citizen panel has been quite useful and effective. The approach that we put in place, it's still a work in progress, but it's been guided by some core set of features and principles combined with experience on the ground doing these panels with verbal feedback from the participants and some stakeholders, and also what was a key component was our evaluative piece. And lastly, there are some key values that have begun to emerge, could be patient experience, equity, collaboration, empowerment, that can be used to guide policy decisions about health systems in Canada. So that concludes my presentation. I'll turn to Stephen and some of the questions from the audience. And also, if you also have feedback or experience that you'd like to share, best practices, please do not hesitate to do that.
That's great. Thanks so much, FP, for a wonderful presentation. Before we we only have a couple minutes left, but before we get to a few of those last questions, I wanted to thank you for a great presentation and for everybody for tuning in. We will be adding to our list of webinars for 2017 shortly, so I would encourage everybody to go to the McMaster Health Forum site and check out our top 10 webinars page. We hope you'll join us for future ones, and as well, a recording from today's webinar will be posted on that top 10 webinar page as well. So you can access this webinar, past webinars, and check out information about future ones. You can also sign up to our monthly e-newsletter, and we'll certainly include information about upcoming webinars in there as well. So in terms of just quickly some of the kind of questions that came up, FP, I believe we addressed the one about digital challenges and digital opportunities, but let's see, we had one about challenges you face in implementing ideas obtained from the forum.
Yep, that's a good question. So I think the limitation of our work is trying to push the message as far as we can. Unfortunately, we're not the ones implementing the policy options, but what we can do is trying to push as far as we can in terms of personalized briefing, in terms of conducting follow-up knowledge translation activities to stimulate those stakeholders and policymakers to actually act upon the citizen panels. One limitation that we may have, given our status within a university, is that all the panels that we do are we are engaged under the Research Ethics Board. So there are some limitations in terms of further contact that we may have with the panel participants. So that's a bit of a limitation on our part, because we know that a lot of participants who took part in the citizen panels, they want to take further action and they want to maintain the group to move forward and build on the momentum that was created that day and take action. But this is something that unfortunately we may not be able to do within our specific context as a research-based organization. But we know that there's an appetite from participants to move forward, but we are limited in that area.
Thanks, Effie. Just to build on that quickly, I mean, all the citizens that do participate, we do send them the results, the panel summary and all the documents from that. And like FP mentioned before, that what we're often doing now is hosting a citizen panel in advance of a stakeholder dialogue. So it's just another way that those insights from the citizen panel get fed into a more involved conversation with stakeholders that can, ultimately it's another way to kind of bring some action from that towards the system. So another question, I know we're at 1 o'clock now, but maybe we can just get through a couple of these quickly, FP, if you have time.
Yes,
so from Rana asked, so you write a deliberation brief and include those in the EBP. How do you include those in the EBP, as a specific section or after each option?
So right now we have we do have specific sections within each evidence briefs where we bring the insights from the citizen panels. So we do have a sections, for instance, under where we describe the different facets of the problem. So we'll have a section describing how a group of citizens that came together for a citizen panel describe from their perspective what's the problem that we're dealing with. And we also have a section in the option and implementation consideration that summarizes the key findings.
Great, thanks. And from Racha, they asked, how many individuals do you typically involve in citizen panels that later inform stakeholder dialogues, and how long does it take in terms of preparations to hold a citizen panel?
So in terms of participants, for each panel, we're aiming to have anywhere between 14 and 16 participants. Why that number? It was a judgment call based on multiple criteria, one of them being logistics, one being our sense that it was a good enough size where people are comfortable sharing information and personal stories, a group that we could potentially also break in smaller groups to have some activities in smaller groups and then bring back to have plenary discussions. So we thought that it was a pretty good number, 14 to 16, to give them a good environment when they can share personal stories. We did a few panels that were a bit larger than that were running between 20 and 30 participants for the cancer drug project. Again, it makes things a bit different. The dynamic is a bit different. If you have more silent participants, it becomes much more challenging to engage them in the conversations. You do need to rely more on small group activities and to get their feedback and input. So I don't think there's any perfect number. It's really based, I think, on your infrastructures, your capacity, the topic that you have, because you do want to have some broad representativeness. So a lot of considerations that are put in the equation. And the last question, I remember, Stephen, can you repeat the question, was about?
Sorry, the previous question or?
The previous question, there was a second element, I believe.
Oh, yes. Sorry, I'm just going back to it now. It was about, I think, how long it takes to get prepared.
It did vary. It usually could go between 2 to 3 months. Sometimes it's a bit longer, for sure. I know that myself and some of my colleagues do enjoy having a bit more flexibility. But what's been more time-consuming is the preparation phase. So the recruitment can be done fairly quickly. In a matter of a week or 2 weeks, we can have the recruitment completed. But it's what takes a bit longer is all the work on the ground to do some preparatory consultation to develop the citizen brief. That takes a little bit longer, but we were usually able to do that within 2 to 3 months.
Great. And I think we have one last question here, FP. So Diane Finegood asked, have we used techniques from systems science like system dynamics, network mapping, causal loop diagrams with the panels? And also asked, what about copies of the slides? For that second part, if it's about slides from this webinar, I'd suggest if you can email us at forum@mcmaster.ca, and then we can correspond about that separately. But I'll let FP respond to the first part.
That's very interesting, Diane. So we haven't used these techniques. I'd be very happy to learn about those and potentially test those in some of the panels. So if you have some key references that you'd like to share with us, that would be really useful. I'll certainly make sure to do some searches on it myself. We haven't used those before, but we're quite open to consider those.
Okay, that's great. Well, thank you very much for everybody for taking time to join us today. And again, thanks to FP for a wonderful participation. That was a very interesting discussion and lots of great questions. So we certainly appreciate your involvement, and we hope that you'll join us for future webinars. Again, as I mentioned, we do these monthly and have a number booked, and we're just going to be posting the details in the next couple of days for October and November and December. So we hope you'll join us for those. And if you have any other feedback or comments or anything, please do email us at forum@mcmaster.ca. And I think that's it for today. Thanks very much.
And again, it's a small community, the public patient engagement community. So keeping that conversation going is quite important. Learning from other experiences and best practices is extremely important. So I'm happy to keep the conversation going through emails, through social media. So it was a pleasure. So have a great day. Thank you very much.